Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 p.m. UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you for watching our video today. This patient was quite an interesting patient that came through. We have on what first appearance looks like some very kind of light coloured wax in this ear. So we're using the standard size Zollner tube just to attempt to start to clear this out first of all. So you can see just pulling from the edges. This was probably one of the more interesting cases of the day. It's actually this is one of my favourites in the top 10 anyway of the removals that we've done here. I quite enjoy doing this one. It's quite an interesting case because what we have is, rather than it being a wax build-up, this is actually a build-up of skin. So the patient's come through with reduced hearing on both sides, has been along to their local doctor who's prescribed some wax softening drops, but obviously because it's not working on wax, it's working on skin. That's all that the softening drops have done, is actually over moisturize the skin in here. So everything, the layers of skin in the canal itself have started to kind of separate and peel away. So we've got this overproduction, this plug of wet moisturized skin, and that's why it looks quite white, and you can see it kind of peeling away in layers from the canal wall underneath. So we're just trying to hold on to some of this skin first of all. It's always more difficult because if you imagine, if you're pulling wax out of the ear canal, then you have the canal, the wax isn't sort of attached to the canal wall unless there's a bit of dry skin which is anchoring it in place, which makes it more difficult. When you're looking at large plugs of skin like this, which is this overproduction of skin, then what you get is all these pieces are still connected to the canal wall. So it means that if you just try and go in there and hold on to it and pull it out, it's not going to work because everything's going to be held in place, if you like, by the surrounding skin on the canal wall. So what we're having to do at the moment is very slowly peel this away. Now the reason I'm just concentrating by using suction mostly on this at the moment is this layer of skin, we have no idea how far back this goes. We can't visualize the eardrum, and this could potentially be stuck to the eardrum. So I want to try and use the suction, but you can see that the suction is not really kind of getting a good enough grip because everything is so well attached to everything else. So what we're going to use is just use the forceps, not so much to try and take this skin out, but more just to break the adhesion. You can see just how soft this skin is. See, it's really, really soft material. So I want to try and kind of break the center so that I've got a better chance of getting one piece away, because if I can get one piece out, then the rest will follow suit. But you can see it's just so there now. Oh, you just move here. There's a gap just above. There we go. So I can see now we've broken the top portion of this skin. So what we can do now is we can try and work the rest of it up into that gap to try and give us a bit of wiggle room in here. So we're trying to expand that gap out, but you can see as we're pulling, look, see it's pulling against the canal wall. Now I can see where it's detached there. So we've managed to get a piece at the bottom of the canal here, which we've managed to break the adhesion against the canal wall, but we really need to kind of try and work our way around this now. So now we can see what we're working with and where the kind of end goal is. We can start to kind of tidy up around the edges now. What you've got to remember with this type of skin is that it's dead skin. It's detached away from the canal wall. Now if you were obviously pulling skin that was still alive, then it would be quite uncomfortable, but that's all the patient feels for this, is just pulling sensation. So there's no discomfort there. You know, and we do always check in with the patients when we're doing this kind of deep suction anyway, even whether it was wax or skin, just to make sure they're feeling okay. So you can see now we've opened that gap up a little bit more at the top. We can see it's kind of the edges of this wax to the bottom right side. We can see that's detached there, but it's still attached to the top left and to the left hand canal wall. So what we need to do now is try and work our way around that. can see just pulling, there we go, just trying to pull that section away as well. So this is actually sitting just in front of the eardrum. Now you couldn't go in here with something like a Jobson horn or a St. Bart's hook or anything like that. It's very deep. It's very attached to everything else. We've got, a really sensitive part of the ear canal. It's just going to cause more problems if you try and sort of plow into that. It's so soft. It's just going to pull through the middle. You're not going to get anything out. Now, there we go. So we've managed to free up that bottom plug. We've got a good grip on this material. You can see just how wet and kind of squishy this material is that's coming out of the canal now. So there we are. So we're just going to go back in now and take a look. So there's the eardrum. You can see where it was all attached. All these layers of skin have come away from the top of the canal wall there. So we're just going to have a quick tidy up. There we go. We have got the second ear was the more difficult of the two to do. So stick with us on this one. It's definitely worth a watch. It was one of my favourites to do the other side. So just peeling some of this kind of skin. You can see the layers. Look, see where it's separated from the layer underneath. Now the eardrum itself looks a bit grey. So what you can see there, the red lines are blood vessels. So it looks to me as if there's just a little bit of fluid, just putting a pressure from behind, pushing against the back of the eardrum, so pushing it forwards. So on this ear canal, what we can see here, this is the second ear, this is a piece of skin. Now I think that piece of skin is dry skin that runs the whole inside of the canal and is actually starting to cover the eardrum, because I think that's the bottom end of it. So what I think we have here, on first examination, it doesn't look like there's much of an issue going on there apart from a little bit of dry skin. But when we talk to the patient, they're on very reduced hearing on that side. Bearing in mind what we've seen coming through on the other side, I think this is one continuous layer of skin that's covered the eardrum and the canal wall that's kind of died off and dried on the surface. So we're just going to use the fine end just to pull this apart. Recognize that kind of whiter, sluffier material there. Look to the top left hand corner. That's what you were seeing in the other ear canal with the separation of the skin layers, but it stayed quite wet. Whereas obviously this skin layer, look, is very dry. So what we need to do is just peel this away from the canal wall, and you can see it's really kind of peeling away. And that is the benefit of using the endoscope, is you can really kind of get a good look. If you were looking in that ear canal with what they call loupes, which are magnified lenses, which is what a lot of people over here in the UK use, you're not really going to get that good view deeper down inside the canal. You may have missed the fact that this was covering the canal walls and covering the eardrum as well. So we're just peeling very slowly using a mixture of suction and forceps at the moment. See, he was pulling away from that canal wall, long strips coming away. There you go. So that's taken one section away. It's pulled the next section down into the entrance of the canal. So we'll just grip that, start pulling that away as well. You can see that whiter material underneath. There you go. So that's coming away. So this is just really, really thin skin layers basically in here that are coming away. Just trying to get a grip on that bit. It's just an awkward angle for the forceps, unfortunately. So you can see the skin underneath now. We're starting to see the actual skin of the canal. There you go. And you can see this layer that's built up, look. So it's going all around the top there. It's going across the bottom. That's the leading edge of the bottom section. There you go. That's coming away as well. See just how much of it was in here, and you can see the difference now between what you saw as far as the skin color when we first took a look in there to what it looks like now. So just trying to get a grip, gentle steady pressure here, pulling away from the top portion of the canal wall. Sometimes you're lucky and the whole thing will come away in one piece, but unfortunately it's just torn off a little bit there. Working on this right side now, so this whole section is still covering the eardrum. You can see the skin of the eardrum underneath there. So this is why the patient had reduced hearing on this side, is that layer had built up over the eardrum and formed like a hardened up layer physically attached to the eardrum, sort of reducing the movement to the eardrum, stopping the sound from getting through. crocodile forceps going in. I gotta remember to breathe. I get so excited doing these. Right, so then we're gonna take this bottom section away. Frustratingly, it's broken away again, so we're gonna have to go back in. There we go. So what we've got left now is just the piece attached to the eardrum, okay? So I'm just aiming for a bottom corner of it there. Lifting gently, gentle, steady pressure here coming away. So that's the bottom right hand side of the eardrum uncovered. But you can see there's still a layer there. So we've got it flapped forwards. That annoying little bit of dry skin there can get shoved out of the way. So we're just going to very, very carefully here, pulling away, very slow pressure. You can see another layer of skin coming away there where there's lots of dried up bits on here. Okay, so you can start to see the eardrum skin there. So we've got a dry piece to the left hand side, also a dry piece to the right hand side. Now I think this is a secondary layer that's been underneath that thicker one, that's been left there. Very, very thin, almost like a skin cell thick, this layer. You can see quite firmly attached. So olive oil is going to go in now. It's going to help to soften everything up. It's going to help to loosen this dead. So you can see that was that annoying flap of dead skin that's just come away. So it's going to really help to loosen the whole section here. So we've managed to get a good grip. By pulling it, we're going to work the olive oil underneath that layer. It's going to help to detach it. You can see just lifting slowly from the base. Right, so that left hand side piece is detached. We've still got this piece to the right hand side. We've got to be super careful here, getting very close to the eardrum. So we need to take away some of this olive oil. I mean, I've put a load in here just to really cover everything we need to. We're just looking to get a grip on that right hand edge. Now you can barely see it, but because we've got the endoscope, we can get a really good view in here. Now watch what happens when we get a grip on this section, and you'll see what I can see then, which is this one skin cell thick layer that's hardened on here. Here it comes. Can you see it coming away? There. Can you see it peeling? So the whole, you could just about make that out. So watch what happens when we get a grip on it. Let's look how big this piece is now as we take it away. This, we're starting to peel. See how big that is? So it's all peeled down into the base, bottom end of the eardrum, onto the skin just in front. There we go. You can see how easy that would have been to miss unless you were looking out for it. But look at that eardrum now. It looks lovely, shiny, pearlescent, exactly the way it should look. Oh, it's very exciting. So you can see this is what we removed. All the dry skin to the right hand side, that blob of squishy stuff to the left. Thanks for watching, guys. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.